Navigant and HFMA recently surveyed 125 CFOs and revenue cycle executives. And through those results, there were three major trends that we found. The first one is really that technology expenditures and budgets are actually increasing within the revenue cycle. With that, there's a hope that there will be continued impact based on technology use on revenue cycle success. There's also significant continued concern around self-pay levels and whether we'll continue to see downward trends in self-pay yields. There's also a significant number of organizations that are not yet utilizing a revenue integrity department, although those that say that they have a revenue integrity department say there's significant impacts on the positive side from implementation of such a department. We asked our survey respondents what types of revenue cycle technology trends they're seeing are, and actually about 74% of them said that they're seeing an increase in overall budget for revenue cycle technologies. That being said, at least half of them said that they either weren't fully leveraging upgrades, so they may have outdated EHRs, or they weren't keeping up with workflow changes or major functionality changes. I think a major impact that we've noted from here is that individuals are spending, exorbitant amounts on an EHR implementation. Then further down the line, realizing there's a lot of time spent in optimization after the fact to really realize the benefit. We should be expecting major revenue impacts. We should be expecting major efficiency gains, and oftentimes we're just not seeing it up front. And that was pretty evident through our survey responses as well. Revenue integrity seems to be an area of a lot of, discussion recently. We, through our survey, asked how many folks have a revenue integrity department in place. Only about 44% said they actually do. That being said, most of those organizations saw significant impacts to net revenue improvement, compliance, and also coding errors. One thing that I think is very important is understanding that revenue integrity really can be that glue between clinical operations, coding, and back-end business office functions. And without it, you often fail to realize the impact of clinical operations within the revenue cycle, which really is becoming more and more apparent as time's going on. Most organizations that responded have some sort of plan to develop a revenue integrity department in the future, but aren't quite sure what all that entails and how to best set up an organizational structure that will actually embrace clinical adaptation into revenue cycle functions. One thing that we're seeing with uncompensated care and self-pay impacts on providers today is definitely that there's an angst about it. There's a lot of worry in the market around what's going to change, and I think with continued changes in healthcare regulation, there continues to be question around where it may head. Most executives are very concerned about how they manage self-pay yield, about how they can best segment their self-pay to be most efficient in their follow-up processes. We are starting to see really a majority of organizations with some level of online presence when it comes to patient engagement. So online bill pays, things like that, online scheduling portals being put into place. But we also see that there's not a lot of advanced analytics going into how do I segment that AR effectively, and how do I make sure that my follow-up staff are managing in a more productive manner.